with a question from Deanne. Deanne says, can you make any recommendations for 3 months post-COVID with ears continually plugged and cracking? She says it's a draining into her throat sometimes, but she's also dealing with anxiety. There's a terrible fear that she's never going to get better and that she might lose her hearing. She said she had a mild case of COVID back in October with just a minimal cold, but the anxiety started at that time and has gotten worse. She's seen other doctors, chiropractors, etc., but no relief. Please help.
So one of the things that we understand from the what we call long hauler syndrome or symptoms that people are having is about 30% of people who are even asymptomatic, meaning didn't have to go to the hospital, got exposure. Some of them didn't even know they had exposure. They just quarantined because someone was positive around them and they tested positive. But they can have these symptoms. One of them commonly is this tinnitus, ringing of the ear. Also, people that have a predisposition of having allergies. And so the key is that once the inflammatory response from the virus is there, it kind of creates a little havoc. And so where we look at is that it kind of goes just like where normal inflammatory responses go, is places that people are sensitive or have weaknesses in. So someone who, like a lot of people have rheumatoid arthritis, if they had exposure, they had flare of their joints, or someone has Crohn's disease had a flare of their colon. So it's not always just the respiratory that we were kind of in the early pandemic. We're worried about, oh my God, respiratory symptoms. However, what we like to look at is once that virus is gone, but there's that kind of post-inflammatory damage that's been there, that can be healed, but it takes time. What we want to look at then going forward is what are the things that are coming in that are still contributing to inflammation in the body? More importantly, allergies, both food that you're consuming and also the environmental allergies that cause the head and neck, ear, nose, and throat symptoms, because anything that's pro-inflammatory thereafter, COVID is like an injury. Once you get injured, for example, then anything that's pro-inflammatory tends to aggravate that easily. So one of the things that we always like to look at is lowering the inflammation, increasing the immune system, and looking at triggers. And that's what I would recommend just to start with.
So can you go into some of those recommendations?
Yeah. So when we look at just for everybody, by the way, so it's not just for the person who's calling in, but for looking at, we always look at immune system for, well, first of all, diet, right? So you need to be looking at eating a whole food plant-based diet. The data shows 79% reduction in those people who were on a plant-based diet who actually got COVID, which is pretty good numbers considering, vaccines and other treatments were about 80%, 85%. So just eating a clean diet, meaning an anti-inflammatory diet, not just a clean diet, but an anti-inflammatory plant-based diet. So if you're eating just a regular standard American diet going forward post-COVID with long hauler, you're going to contribute to having longer symptoms, right? So you want to be.
I saw that study on the plant-based diet. Can you repeat that? Because I think that is so profound. We had that early on. We had that study early last year, I think, is when the data came out, right? In early 2021 is when I saw it anyway. And yeah, I mean, that was I think it was 79% reduction in hospitalization or serious symptomology from COVID from people on a plant-based diet, right?
Right, because it's all about being in an anti-inflammatory state, and COVID is a pro-inflammatory virus, right? So is any chronic disease or injuries, it becomes an inflammatory condition. So you have to look at what are the things that you can do to help reduce your pre-burden before you get exposed. So lowering your inflammatory burden by eating an anti-inflammatory diet, which is a plant-based diet. I mean, for those who want to get more information, they can read my book, An Inflammation Nation. That'll go into it in detail. But the goal is that you have to be setting up the foundation. So before we even talk about natural anti-inflammatories and things to stimulate your immune system, they will only go so far. But if you're putting pro-inflammatory foods, animal proteins, saturated fats, for example, and highly refined vegetable oils like fried foods as well, those are all pro-inflammatory things. And so you want to be just clean with the diet first and foremost. But 79% reduction, I mean, literally, like, if we had a drug that did that very simply, like, again, that'd be a blockbuster. You see television commercials, we'd be recommending everybody, but it's not, because it's a lifestyle change, and Americans don't really want to take a lifestyle change. They'd rather take a pill or do something at the last minute. And where our goal is not to shame or blame anything, is our goal is to say, is like, can we going forward, because this is going to be forever now, like these kind of new spiral viral outbreaks, is how do we just lower our risk overall, not only from the variants, but how do I lower my risk of heart disease and diabetes and cancer and Alzheimer's and other kinds of conditions? So lowering the inflammation is key. And we like to look at triggers of food. So we actually look at food sensitivities. That's one thing that we specifically look at. So even if you are on a plant-based diet, you can still have pro-inflammatory foods from vegetables, grains, legumes, and fruits. So we always want to look at the patient's immune system and looking at whether there's an immediate or delayed reaction, meaning something you can eat now triggering it, within an hour, and something that you can eat 4 days, up to 4 days later, you can have this. So there's things that are sneaking in indirectly, and everybody's unique. So some people may not have anything, and some people may have a lot of things. And even if you're in a plant-based diet, you can still have certain foods in the plant kingdom that are triggering your immune system to trigger inflammation. So we always want to kind of reduce that risk. But going down to the immune system, then simple things that everybody can do is, number one is be looking at and checking your vitamin D levels. Vitamin D is super cheap, super inexpensive. D3, we always give about 5,000 IUs, international units daily. It's a fat soluble vitamin, meaning it absorbs 60% better with fat. So you take the vitamin D with your heaviest meal or your largest meal. So if you're having like a little avocado toast or guacamole or a little bit of olive oil on a salad or something like that, or a nut butter on a sprouted grain bread or something like that, then that's the time that you take the vitamin D. It will absorb 60% better. In the studies, though, and there's many studies that have been published since COVID, for example, is that, there's a general goal of having a range between 60 and 100 where we look at the immune literature. I prefer having 70 to 100 because that's where we look at some of the oncology data for cancer patients having better outcomes. So it's a simple biomarker of looking at how strong your immune system is functioning. If your numbers are lower, then when you get exposed, your risk of having longer symptoms or more complications is there. So when they have wonderful studies where they have similar patients coming in with the same comorbid condition, maybe 350-pound male with diabetes, hypertension, blood pressure, et cetera, and someone comes in with a blood level of higher than 60, and someone comes in a blood level under 30 on their blood test of vitamin D, the person who has a higher level actually has better outcome. So it's one thing that everybody should do. Now, the key is not just taking it, because a lot of people are like, well, I just take tons of it, or I just take a little bit in my multivitamin. The key is actually not the dose. The key is what is your level, because everybody's microbiome and what they do and how they take and absorb is different. So actually having it checked, I recommend everybody checking it every 6 months, because it's the cheapest, simplest thing that everybody can afford that actually will reduce not only your risk of getting COVID, for example, and keeping your immune system, but all chronic diseases, about 60% reduction in the data. So keeping that up just makes your immune system work better. Keeping that up makes your medications work better, makes your supplements work better. So it's something that a lot of people take all the time now, but the problem is they're not tested. And when we test them, they're coming in low because they haven't got that blood level up to the level that we need. Doesn't mean you want to be taking super high doses every day. The idea is that you have to get tested, and then we usually give people a protocol to bring them up to that optimum range, and then they can maintain very successful.
We hope you enjoyed this short excerpt from the Health and Healing Club. This entire video, including an in-depth discussion and thoughtful and inspiring questions and answers, is available inside the Health and Healing Club, along with hundreds of hours of premium and exclusive life-changing content, practices, and holistic, natural, and integrative solutions for health and healing. You can start your free trial today at healthandhealingclub.com.